I was very blessed to have a wonderful husband who I love with all my heart. I mean, he's the one that kind of kicked me and says, why don't you do this for yourself? And when he told me that, I never thought of backing myself. I always backed, other people and helped them make their agencies better. And so when he said that, I said, you're right. And so then I started seeing my own patients. And when we first started, I was the only nurse. I was all over the place. I would easily put over 100 miles on my car. And so, but I loved what I did. And our patients loved us. And they would say, in Spanish, they would tell me, mija, deme su tarjeta, le di un embolio a mi compadre. So in other words, young lady, can I have your business card? Because my compadre had a stroke and he definitely needs help and we don't want anybody else.
Well, the purpose for Launcher and Tender Care was Ann always had a vision to provide better home health care to the El Paso community. And that was the vision, and that's how we started. And it's been extremely successful. It's been a great partnership between Ann and I, besides being married. She has a clinical background. I have a strong business background, and as a business, it's grown very well. Well, the early days were obviously not smooth at first. It takes a while. It was just Ann was seeing patients. I was taking care of the office. We're trying to build our reputation, and it just takes time. So the early years were, it was a rough start. We were working, 12, 14 hours a day just to keep things afloat and build the business.
I started from the very beginning. When we started making forms, making packets, we were on paper back then. So we weren't all electronic the way we are now. We were on paper, so we made everything. When she started the agency and she felt that call to give me the opportunity to be here, it was really special. It was scary, but it wasn't hard to make that decision because I knew who she was, and I knew where I was going, and I knew that it was going to be done right. That was everything. If anything Ann says, you can't get it wrong if you do it right. That's what she always says. And so I believe that, and that's how we always worked.
I started with the company. I was actually the second employee ever hired. So I've been with the company all 20 years. I've worked the front office, every position in the front office, from data entry back when we had to enter data manually. Started on RemCon, moved to another bigger office, moved to another bigger office, moved to another bigger office, and then expanded into Las Cruces. One of the things I noticed when I was out doing the sales, a lot of physicians would ask me, do we offer services in Las Cruces? And instead of continually telling them no, we came back and said, this is an opportunity to expand our caring professionals' reach and go all the way into New Mexico. Once we got New Mexico going, then we knew we were big time. We were finally doing something that meant a change in the way healthcare is done here in El Paso and Las Cruces.
Tonight, U.S. airports on high alert, screening passengers for symptoms of a deadly new virus.
I was the first nurse that did the first COVID admission for the agency, and I remember going into the patient's home and being absolutely terrified because at that point we didn't know much. We didn't know concrete how it's transmitted, how bad it was. This was just the start. I remember being so scared that I got in my car and I couldn't remember if I cross-contaminated anything, and I panicked and I threw my shoes in the trash. It really showed the importance of just the human-to-human relationships. It taught me as a member of Tender Care how we all struggled together as a team and how we had to work as a team to make sure that our patients were taken care of. And we knew that not only did our fellow nurses and therapists, have our back, the agency had our back also.
And so we've done that, and it's been tremendous growth.
From what I see from the beginning to what we are now, for me, it's amazing. And I'm very happy to be a part of that. I'm proud to be a part of that. I really am.
Fantastic impact on the communities, the providers. They appreciate our work. We've really proven ourselves over the past 20 years that we can provide the services that El Paso needs in home health, hospice. Now we've started primary care also.
You can't go wrong when you do it right.